I'm here to share with you 3 things that if you've been struggling with stiff, achy, sore hips, specifically that anterior, the front of the hip, I'm going to share with you some things that you may find really relieving and help restore some function, some things that have worked well with patients in the past and I've used on myself. Hi, I'm Dr. Matt. Welcome to my quick self-help videos where I share simple and easy tips on stretching and movement to help you improve your quality of life. Remember to share and subscribe. Hi, I'm Dr. Matt Bradbury, family corrective chiropractor here in Georgetown, Ontario, Canada. This is our practice, One Life Family Chiropractic. And today, I actually want to share with you how to help yourself if you've been struggling with hip pain in the front. And specifically, you'll feel bony protuberances fall down into the front and at the crease of your hip. If things are stiff and sore and achy, you may find these tips, these next 3 tips, really helpful in terms of helping how you move, helping improve how you function, and potentially relieving some discomfort. And some things I like to always remind you of, and that I find good as a reminder for myself. And of course, before I explain a little bit more, of course, if you've been enjoying our content, I'd love to see more of you. So please take a moment and click like on the video and even subscribe, because I'd love to see more of you in the future. As I was sharing with you, I want you to think for a minute just how much you sit for those long periods of times. And now we were designed to move, jump, run, play, lift things, move, and be mobile throughout the day, constantly moving. We weren't designed necessarily to sit with our hips flexed like this. This is your leg, your hips flexed, slouched over. And I always think about, if you're practicing this for 35 hours a week, and then all of a sudden you're doing your workout or you want to run, play with your kids, and let's say you're working out for 3 days a week, and let's say 3 hours, the 3 hours isn't necessarily going to combat the training of the 35 hours like this. So we got to do a little more. We got to stand up, we got to move around, and the most important thing you can do for yourself is implement those standing periods. Make sure you have a standing desk so that you're up, you're mobile, and your hips find this range of motion. Periodically sit down, but the best posture is always the next posture as you change and even fidget throughout the day to help keep yourself more alert and help keep your hips that much looser. Of course, as well, consider the health of your spine and your nervous system. One really neat thing is that, as we often see with cases and patients in the past, is oftentimes they'll respond really well to care in terms of helping them move better, thrive, and have more brain-body awareness so that they can help their bodies heal and move at their best, getting their hips looser, their spine. And as a family corrective chiropractor, probably shared in the past, but the most important areas, how your spine moves and reducing nerve irritation, specifically up here and down here, so that all the messages from here, remember, your brain's controlling your body through your spinal cord to your muscles, your organs, all the important things, all the information has to get to where it needs to be. So consider the health of the spine and the nervous system. And personally speaking, one of the things that I find really something to be aware of is if you manage your stress better, and specifically corrective chiropractic care may help you manage your stress better, typically you're looser. You breathe a little easier, things feel lighter, right? Shoulders may be more relaxed. And when you're more amped up and more stressed, if you're shifted and stuck, it may be implicated in how tense you are. And things like your hip flexors may be even more tight. So consider that, okay? Now, the first thing I want to talk to you about is actually, and I was talking to somebody about this last week, is just how they move and their habits throughout the day. So what I wanted to talk to you about first is actually learning to activate your glutes a little more. You guessed it, these muscles through here. And oftentimes when you have hip pain or discomfort, a lot of times your glutes are not firing as well. Whether you're lifting, running, doing some sort of sport, you could probably afford to help strength train and make sure there's balance in your glute muscles, specifically what's called your glute medius muscle, that smaller muscle at the top through here that helps your hip move and helps you remain upright. So one thing that I've been working on and I've found really useful is actually just getting the side bridge position. Is when you're like this, what I want you to do is actually just have your hips slightly flexed at an elbow to begin with. And all you're going to do is actually lift yourself up and drop back down. And now I'll do this for 8 to 12 reps. And when I'm coming up, I'm thinking specifically about shifting my hips forward, but most importantly, getting them off the ground and activating your core, but also the smaller, your glute medius muscle. And you're working in that 8 to 12 rep range. I would do both sides. I'd go over to the other side, do the other side. Really cool. If you're going out for a run or going to lift some weights, great one to warm up with. But also if you're having that anterior hip stiffness and pain, start training your glutes a little bit harder and watch and see what happens. Stick with this. I would do it daily in terms of 2 to 3 sets to help strengthen your glute muscles. Now, the soft tissue ball, you can use this on the front of your hip. You can roll off to the side. You may notice it particularly tender. You can even come around to the top of the glutes just to give them a bit of a wake-up call and help loosen them up so that they can move better. You can start by lying on the front of your hip just like this. And when you're down here, if you find it, this is probably going to be the more aggressive version simply because it's got a smaller point and you're putting that weight into it. But what you can do is just breathe into it. And you'll notice the ball right now is on the front of my hip here. And I'm breathing into it. Now what I'll do is I'll find the ropey spots, if you will, the ropey spots, the tender areas, breathe into them. With this particular one, you may find you want to start with a foam roller, something with a little more surface area. It may just be easier for you. But when you're doing it, you start with 30 seconds to 2 minutes, breathe. And now I'm going to show you on the opposite side just so you can see. But what I'll do is I'll actually work up to the smaller muscles, your TFL, your glute med. And you'll see here, it's positioned on my side, and I can feel the bony part of my hip, and I fall off to the back side of it, or a little bit more to the top side of it. And I breathe into it. A little bit tender on that side. Again, you'll notice my small oscillations on the table here. Just breathing. I can even work in a circular motion. And again, 30 seconds to a minute to 2 minutes, breathing. And then I'll work around so I get more into the top of my glute, just like this. And now you're probably going to find the top of that glute is a bit tender and possibly sore. But you're working on that whole hip complex to loosen up your hips. And this is great if you find yourself saying, I don't have time. First of all, you got to create the time, right? And carve out that time. And how I would do that? Well, if you watch your favorite show on TV at night for 22 minutes to half an hour, spend that time, get on the floor, work on your hip, stretch it out, loosen it up, train your glutes to fire better so you can help loosen up your hip. And a lot of times that anterior hip stiffness, if you learn to stretch, mobilize your hips and train your glutes better, things start to get a little easier. Now, I've done that. What I'd like you to consider is just simply talking about the couch stretch. And when we're here with the couch stretch, you'll see what I mean. But imagine this is your couch with the seat, and this is the last one I want to share with you, and a couple of variations of it, but a couple of things I find useful, just simply because, again, we spend so much time like this. I want you to now do the opposite like this. So what you're going to do is literally hop up, put the top of this foot on the back of the couch, and work your way up. For demonstration purposes, I'm going to bring my foot up by hand. And what I'm going to do is just hang out just like that and really focused on not letting myself tip forward like this, but I'll be up just like this, squeezing my glutes a little bit. And I'm thinking about, okay, quads, the hip flexors, and all that anterior hip stiffness. You're probably going to find one is tighter than the other. And when you're working and doing your self-care, one may be a little bit weaker, and also one may be a little bit more tender when you do the ball. So between the activation of the glutes, the side plank position with the hip drop, the soft tissue work, and the couch stretch, you may find one side a little bit more off compared to the others in the sense that it's weaker, more stiff, more tender, and that's probably going to be your side that you're going to be working on. And so focus on breathing with this one, 30 seconds to 2 minutes. If this is too aggressive with the heel to the buttocks, drop it just like this and just hang out here. And now even when you're at your desk at work during the day, hang out in this position, opening up your hips. So you can see it's simple movements that if you apply them consistently, oftentimes things will get easier. The hardest part is just carving out the time to retrain things and actually do them. So take your time, be specific, set some intention, grab yourself a calendar at your desk, stick your calendar up, hash off scratch off every time that you actually do your exercises so that you can see that you are committed to the process and the inputs. And oftentimes, if you stay committed to the process and the inputs, the outcome will come in time. Just stay committed and keep being consistent. Anyways, thanks so much for tuning in today. I'd love to hear your questions and comments below. If you've enjoyed today, please take a moment. As I said in the beginning, I'd love to see more of you. So please click subscribe so you can see our latest updates, or like, right? Let people know we're out there. And as I've shared in the past episodes, we got a big mission in terms of helping people understand their health more, their spine and nervous system health, as I was talking about in the beginning, how to manage their stress, and that you need more function for more health. And I simply can't do it alone. I need your help. So if you take a moment, please click share on this video so that someone else can get help their own body. Or if you know someone in particular you're thinking about, grab the URL and send it off to them. I appreciate you very much. Thanks so much for doing that and tuning in. We'll talk to you soon. Bye for now.